Good afternoon. I'm Nicole Trurag, Associate Director of the Center for Financial Security at UW-Madison. Welcome to today's webinar on promoting financial capability, building services with families in Head Start. Promoting financial capability, building services with families in Head Start. Our presenter today is Peggy Olive, MSW, Family Living Agent with University of Wisconsin Extension, Cooperative Extension. Our discussant today is Christine Callahan, Research Lead Specialist, Clinical Financial Social Work Initiative at the University of Maryland School of Social Work. Just a reminder before we get started, if you have any technical difficulties during today's webinar, please call 1-800-442-4614. And to submit questions for the Q&A portion of the webinar, locate the dark gray bar near the top of Media Site, click on the Ask a Question icon, and a window will open. Please type your name, email address, and your question and hit send, and you can submit questions at any point during the webinar. And a reminder that today's webinar will be archived within 1 week at cfs.wisc.edu and also on YouTube. With that, I'll turn things over to Peggy.
Thanks, Nicole. And it's great to be here today to talk about our financial education series, our Promoting Financial Capability Building Services with Families in Head Start. It's our Money Smart in Head Start program. And just to clear up a little something, sometimes people wonder if our Money Smart uses the FDIC Money Smart materials, and they don't. It's just our title, Money Smart in Head Start, using our materials that we've created with the UW Extension. And this project is something I've been working on since about 2009 and came about from a few different interests. Working with our Center for Financial Security and some of their efforts with the UW-Madison School for Social Work, and trying to integrate some financial education, financial management practices into the human services. So doing a little bit of work with that group and that project, and also working in a small rural community, Richland County here in Wisconsin. I work closely with our Head Start agency partners, and frequently the families would have questions about financial education, financial management, and the Head Start staff people had the relationship with the families, and the families didn't mind coming to their Head Start agency for information, but they didn't know me, and they might not want to come into my office to talk about their financial education or financial management needs. So I was looking for some other way to bridge that gap and get out there, more outreach with our financial education information. Also, I mentioned this is a financial capability building effort, and the way we were looking at financial capability is that financial literacy and financial knowledge is very important. It's also just one piece of what people need to know about handling their finances. So there's also action. Once a person knows what the best practices are for financial management, what do they do? What kind of habits are in place? What kind of behaviors are going on? There's also access. What kind of financial products and services are people currently using? What are they able to use? Our learners, what are they willing to use? And then the influences, and perhaps that might even be one of the greatest influences on our financial capability. Those are all the factors that can contribute to whether an individual engages in some sound financial practices and whether or not they're able to. For our project, we had a multitude of partners to help pull this off. We started the project in 2009 as a pilot with 7 UW Extension Family Living educators in 7 different counties, and then did a lot of tweaking of our materials that I will talk about here today, and expanded that in 2010-2011 to include 16 counties. And the findings that I'll be talking about today, too, are from that 2010-2011 with our 16 counties. We also had 10 Head Start partner agencies in those 16 counties. Here in Wisconsin, Head Start agencies, they might be in 1 county, they might be in 2 or 3 or 4 counties. So with our 16 counties, we had 10 different Head Start agency partners. And then we also couldn't have done this project without our participating 507 households that were enrolled in the early Head Start and Head Start in those 16 counties. We had a total of 1,500 households in those counties, and they were asked to voluntarily participate in our program, and about a third, 507, agreed to do that. Our other partners are the University of Wisconsin Extension, Madison, our family and consumer economics specialist, Michael Collins, and then financial support from the Annie E. Casey Foundation that helped make this project possible, and then technical support from UW-Madison Center for Financial Security. I'm not a numbers person myself, so I'm more of a practitioner, so having that assistance with all of our data was most needed. So again, I mentioned this project first started off in 2009, and then the data that we collected was 2010, 2011. The way our project was set up is that we had a baseline financial management survey that households were given in fall at the start of the school year. Then during the school year, we had a range of financial education interventions. We had 8 monthly newsletters that were created by a team of our family living agents on the project. We had 2 financial workshops we also created. And then something that has been relatively new for us here in Wisconsin is financial coaching that we provided with families, with select families. And then we also had some families, about 100 in this study, who didn't receive any kind of financial education services during the school year, just to have our comparison group. And then again, we had a follow-up survey in spring, the same survey that families had received in fall. And the surveys were disseminated in a few different ways. In some Head Start agencies, the surveys were brought right by the Head Start staff to the families in their home during a home visit, and families were encouraged to participate and fill out the survey there. Some of my colleagues attended Head Start family nights or other Head Start activities and disseminated the surveys right there to parents at the activities. And so they were really found that the best practice for getting the surveys out was just that one-on-one communication with the families. A little bit more about the financial surveys. And I also want to stress I'll be sharing our website at the end of my presentation here because all of these materials, the surveys, the newsletters, the workshops, it's all available on our website for anyone to be able to use. But a purpose of our financial surveys, the pre and the post, was to measure changes in self-reported financial attitudes and behaviors. We didn't use any third-party data. Working with some families, they did share the credit reports or credit scores, but for our surveys, it was all self-reported. Some examples of the measurement tools we used were measures of distress, such as a financial stress scale, with 0 being no stress or 10 is overwhelming stress. Financial behaviors are, do you currently have a checking account, savings account, credit card? Or financial planning, do you have at least one financial goal? And then asking them to share that goal with us. With our participating Head Start households, in the fall of 2010, we had 507 households, and 92% were women. And I should also clarify that each household was asked just to submit one survey. So we could see that the women were more likely to complete the survey in the household. So 92% were women, 57% were unmarried, 88% were white, which matches our demographics here in the state of Wisconsin. 89% had completed high school, 48% had attended at least some college, and then 28% were homeowners. A little bit more about our participants at the start of the school year. 21% had one child in their home, 37%, a larger number, had 2 children in the home, and then 25% had 3 children in the home, and then 17% had 4. We also asked about monthly take-home income. So 29% of the households in our project had $800 or less for their take-home income. And between $801 and $1,600 is 40%, and a little bit more with 20% and 11%. So you could see the majority, about 2/3 of the families here, had annual income of about $20,000 or less. A little bit more about our respondents and the households and the families in our project. You could see almost 70% had a savings account and or a checking account, but then about a quarter were unbanked. They had neither a savings nor a checking account. and less than 20% had some type of retirement account with some money in that. Also, on our financial management survey, 60% of the households reported having difficulty paying some of their loans or debts. This was at the start of the school year. Just over a third reported paying their bills late, almost always or often. About a third had received 3 or more calls from a creditor in the past 3 months. And 6% of respondents had a rainy day fund worth 3 months' worth of expenses, compared to 43% of Wisconsin's population as a whole. So as I'd mentioned, our financial capability building interventions included newsletters, workshops, and financial coaching, plus about 100 households receiving no services during our project. With the 8 financial newsletters, you can see the topics on your screen. Just very basic. They were written at about an 8th grade level, and they were one page, 2-sided for each page. And you can only go into so much on each topic, such as setting goals or spending your money or planning for taxes. So we tried to hit some of those most important bullet points. You can see a copy of the newsletter online there. We tried to break out some of the bullet points in boxes, use some clip art, try to walk people through what they can do with that information so that it's actionable, and you can also take the information and apply it for your situation. With our financial newsletters, in addition to our basic financial survey information, we did include one page just to get a little more feedback on these newsletters. So we received 154 newsletter surveys at the end of the school year, just specifically on the newsletter. 67% of the households reported that they read most or all of these 8 monthly newsletters, while 32% skim it. 1 in 5 households said that they passed their newsletter along to share with somebody else. And 93% rated the information in the newsletters as somewhat or very helpful compared to other sources such as friends and websites. We also found with the financial newsletters, on this graph it shows if people agreed, disagreed, or neither. So almost half of the households receiving a newsletter had agreed that the financial newsletters helped them set a financial goal and make a spending plan. A little over 40% felt that it helped them to get the most from their tax credits, or it helped them to figure out their debt and start to make payments. And about a third said the newsletters helped or encouraged them to put money into savings. So for 16 pages of information, we were happy with just the results that it gave people a little bit of boost to take some action. I also mentioned we provided some financial workshops. And again, this wasn't in all 16 counties, but in 11 counties, the educators there provided 1 or 2 financial management workshops. So there was 21 workshops offered in total with 135 participants. And you can see some of the comments. The families who did come to a workshop, and sometimes they attended with a Head Start staff member, were very grateful for the information, very interested in it. I think the challenge and the rub is always trying to get people to attend a workshop. So it seemed like the locations that had the best attendance at workshops had a structure built in. Perhaps they were at a family night where transportation and childcare was provided while the parents attended a workshop. Some had a workshop during the daytime, so when parents came to pick up their children from the Head Start program, they would come a little bit early, attend a workshop, and then pick up their kids and go home. So that seemed to provide the best natural venues for reaching people with a little bit more information. And the workshops were designed to complement the newsletters, not repeat the information, but add a little bit more to that. And that third piece that I mentioned was financial coaching. And we had family living educators in 8 counties who were trained in financial coaching and provided coaching for 24 households that were working towards their financial goals. Some of the key elements in our financial coaching program is that we approached coaching as a collaborative process to help individuals change behavior. Our coaching focused on long-term outcomes where people would like to be in 2, 3, 4 years. The coaching was based on clients' unique needs and goals, and it included action steps and check-in for accountability. So we could meet with households in person at the beginning of the school year, come up with a plan, what will you be doing in the next few weeks or the month, check in on the month, usually a phone call, maybe an email or text message, see how it's going. and then check in once a month during the school year, and then have a final meeting at the end of the school year. And it gave families an opportunity to set goals, reach those goals, practice new skills, and get support for reaching and trying out those new skills. Some things we learned when it came to coaching in our baseline survey that we had distributed in fall. On this graph, you can see in blue are respondents who are interested in working with a financial coach, and then in yellow were individuals who sat on the survey that they were either not interested in working with a financial coach or they were unsure about coaching. So you can see we had about a third of the households on our survey said they might be interested in working with a coach. A third said they're not interested, and about a third said they weren't sure about it. They'd need more information. So some things we learned about individuals who self-identified as interested in working with a financial coach is that these individuals on this graph in blue, they had less confidence in their own ability to save for the future. They had less confidence in their ability to budget, and they also had greater stress about their financial situation. You can see that on our stress scale with that last item, that with 1 being no stress about finances and 10 being overwhelming stress, you can see in general that the families in our project were very stressed out about finances, with the average being about a 6, but families who are interested in coaching were a little bit closer to an 8, closer to having some overwhelming stress. We also discovered that parents who are more interested in coaching reported that in addition, they also have more difficulty in paying their loans or debts, and they're more likely to have a financial goal. So they're feeling less confident, they're having more difficulties, but they also have a clear goal in mind of something they'd like to reach. We then conducted our follow-up survey at the end of the school year, right around May. And the surveys were mailed directly to households, because we had their contact information from the baseline survey in fall. And out of the 507 households who completed the baseline survey in fall, 193 of those households also completed the follow-up survey. So we had about a third of those, or about 38% of the parents completed both the fall and the spring surveys. And then we compared the differences between households who received the newsletters and may have also taken part in a workshop or a coaching to households who did not receive any of the financial capability building education. So you can see on this graph that our comparison group is in yellow, and our households who received some type of financial education or financial capability programming are in blue. And looking at some of the differences in attitudes for these two different groups, which includes worries, their confidence level, their self-assessed ability to manage their finances, we see that with the comparison group between the beginning of the school year and the end of the school year, overall their worrying about finances went down about 1%. In our program group, their worrying about finances dropped overall 9%. We looked at their difficulty in paying bills from the beginning to the end of the school year. No change in our comparison group. It dropped 7%. So there was a change of 7% felt it was less difficult for them to pay bills. When we looked at confidence about managing their finances, no change in the comparison group. The confidence level went up overall 10% in our group who received some financial education services. In the ability to budget, it went down 1% in the comparison group, went up 15% in our program group. So they indicated a 15% increase in their self-perceived ability to manage their budget. And then with being able to save, the comparison group went up 10% and our program group went up 19% in their reported ability to save. Looking at difference in actual behaviors, and again, these are self-reported behaviors for the program and comparison group, including debt levels, bill payment, and using a written budget. In the comparison group, their debt level overall went up 6% by the end of the school year. In our program group, they reported their debt level dropped 12% from the beginning to the end of the school year. For bill collections, receiving calls from bill collectors in the last 3 months, the comparison group went up 9%, and our program group, it dropped 6%. So there was a 6% drop in receiving calls from the collectors. And we asked about downloading their credit report in the past year. It dropped 14%, so they were less likely to have downloaded their credit report in our comparison group. And they were 32% more likely to have downloaded a credit report in our control group by the end of the school year. And then probably most notably here, having a written budget. There was no change with the comparison group, but in our program group, they reported overall they were a 92% increase in having a written budget by the end of the school year. And then we broke it down a little bit more. We looked at differences between the comparison group and households who received just the monthly financial newsletters, and then households who received the financial newsletters, and they might have also participated in financial education workshops and or the coaching. So again, there might have been a little more motivation to participate in the coaching or the workshop, but then they also had some more challenges as we discussed. So in this chart, it shows the control group in yellow, newsletter-only households in red, and then newsletters with perhaps workshops or coaching in blue. So looking at the first item, a change in difficulty managing debt, for the control group, it went up 48% overall in their self-reported difficulties managing debt. It dropped 14% in the newsletter group and dropped 83% in their self-reported difficulties managing debt in the newsletter or workshops or coaching. So there was really an 83% improvement in their managing their debt. Looking at the change in ability to save in the control group dropped 8%, so they were reported an 8% drop in how much they were able to save. It went up 24% in the newsletter-only group and went up 41% in our newsletters with the workshops or coaching. And then the last item, the change in downloading the credit report dropped 12% in the control group, increased 5% in newsletters and 8% in newsletters with workshops or coaching. So really what we see in our program overall is that each of the three financial capability services that were offered through our Money Smart and Head Start program led to improved financial security relative to receiving no services. We were able to leverage existing community resources to reach vulnerable populations who might not be out there seeking financial management education, might be interested in it, but might have too much going on that they just wouldn't be reaching out or going to another program. And we also feel we have a highly replicable initiative for financial capability efforts. And speaking of being replicable, we do have all of these materials posted on our Money Smart and Head Start website. We also have a few papers out there that talk a little bit about some of our approaches with CFS issue brief, and then the last one on there is the Journal of Extension, talking about our use of financial coaching here in Wisconsin.
Great.
Okay, thanks.
Thank you so much, Peggy. And with that, we'll turn things over to Christine Callahan. Christine?
Great. Hi. Thank you so much. Thank you, Nicole, and thank you, Peggy, for this wonderful presentation on your work. It's a pleasure to be with you here today. I am Research Lead Specialist Clinical at the Financial Social Work Initiative at the University of Maryland School of Social Work. I've been a social worker, a clinical social worker, for about 20 years. 19 of those years were at the NIH Clinical Center in Bethesda, Maryland, which is a federal research hospital where patients can come and take part free of charge in clinical trials offered both outpatient and inpatient. About 10 years ago, when I was working very intensively with cancer patients enrolled on clinical trials, I became really struck with the fact that many patients were becoming really financially devastated by a cancer diagnosis and treatment. And this was even occurring with patients who were enrolled in clinical trials, which are free of charge at the NIH Clinical Center, but people were still having to manage other responsibilities, mortgage, rent, often dealing with sudden job loss, waiting for SSI or SSDI to kick in. And I became really, really concerned about the financial plight that these patients were experiencing. And often, despite our best efforts in working together, things did not work out very well. And people sometimes lost their homes, they lost their jobs, things would become even more difficult if they were estranged from family and friends. So this commitment led me to want to seek my PhD in social work, and I began that in 2005 at Catholic University. And my dissertation, because this commitment to the issue of financial wellness and financial quality of life led me to my dissertation, which was a financial quality of life study with a cross-section of cancer patients drawn from 2 different hospitals in the Washington, D.C. area, one of which was my hospital, and then the other one was the Washington Cancer Institute at the Washington Hospital Center. And I looked at different vulnerabilities or potential vulnerabilities and how those impact on financial quality of life. And I found that, not surprisingly, things such as barriers and lack of health insurance, lack of social support, a great deal of financial strain, those were just some of the variables that impacted on financial quality of life. By that time, my path had crossed with the Financial Social Work Initiative here at the University of Maryland School of Social Work. And so when a job opportunity as a social worker and a researcher came about, I was very glad to be able to apply for the position and then to get the position, and I've been on board since last July. Next slide, Nicole. So the Financial Social Work Initiative has been around for about 5 or 6 years. It was established in 2009, but work and planning, conceptualization had been taking place a little bit before that, especially with alumni of our school, along with our dean and with other faculty and staff here at the school, recognizing that financial issues, especially coming through the recession that we have all experienced, that clients and communities were greatly in need of really financially savvy clinical work, looking at both the financial and psychosocial issues that clients and communities were presenting with. So we were able to establish this initiative, and our focus really is 3-pronged. We're focused on education within the master's curriculum here, offering a course. I'll talk about that in a couple of minutes, but offering material and coursework and perspective throughout the curriculum with an emphasis on financial social work and how it is so important to be knowledgeable about the financial issues that our clients are facing. Kind of going along with that is the emphasis on practice and how we can have a really savvy practice with clients and communities. And then the last prong is research. And I know Peggy's been talking about her program, and there are other programs throughout the nation as well. But really looking at this from a research perspective and with the programs that are being established, doing research in order to evaluate effectiveness and to identify needs and to develop new interventions and measures, among many other things. Next slide. So our evolution of the Financial Social Work Initiative here, social workers and our alumni in the community recognized the need. They brought attention to our dean that social work students and new grads really need to be equipped to handle financial issues along with psychosocial issues, and really having them go hand in hand is the ideal way to practice. And that also, especially as a result of the recession, that people were presenting with complex financial issues and that we needed to have skilled practitioners and counselors and other providers of care in place to really deal with these head on. Next slide. So around 2009, my colleague Jody Jacobson, who is an associate professor here at the University of Maryland School of Social Work, she was named chair of the initiative. and I joined last July. And our steering committee on the initiative has just been growing and growing with interested partners not only from within the school, but also from our agency partners and other nonprofits and agencies within Baltimore City and throughout Maryland in really integrating financial realities, financial stability, financial capability into our spheres of practice, whether it's micro or macro. Okay, next slide. So this slide is on just why financial social work. Why is it so important? And it's not at all to detract from traditional psychosocial counseling or counseling approaches and interventions and so forth. It's really a way of adding or integrating the financial piece into the psychosocial piece. As you know, clients and people that we're serving are not really detracting or separating out finances from emotional distress and so forth. And so really it's ideal for us also to be addressing both with our clients and communities. Kind of tied into this is also exploring the psychological aspects of money and financial wellness. And there's been a lot of good work, good literature out there exploring this integration. I'm thinking of the work of Rita Wolfson of the Center for Financial Social Work, also Sybil Solomon, who's an educator and a trainer in this area. And there's also good resources and good literature on interventions that are combining both the psychosocial and the financial piece and really addressing both ideally. A skilled clinician will deal with both realities. Next slide. Kind of going into our three-pronged approach here, I'm going to be talking first about education and then going on into practice and research and things that we're doing here at the initiative to really blend financial social work into what's happening here at the University of Maryland. We do have a course. It's an advanced elective course in the MSW program on financial stability for individuals and communities. And we're presently retooling this course so that it will be applicable for both our clinical and our macro students. Here at the university, we call them MACO students, which stands for Management and Community Organizing, but it's like a macro track, and that's one thing that we're doing. We're also seeking to infuse a lot of these concepts and materials through other courses that are offered in the MSW curriculum. And then we also offer several courses through our continuing ed program. These courses are offered both in the fall and the spring. And under our initiative, we're sponsoring several courses on financial stability for individuals and families and communities, accompanying tools and technologies that assist with this. This fall, I'm going to be offering a course on medical debt and financial social work. And again, we're just hoping to expand these even more. And like I said, these are also offered every spring and fall. Next slide. Also on education and practice with our MSW students, there are a variety of field placements where financial social work is a part of what is being done with clients, or also with community advocacy for those macro or MACO placements. We have a really unique office here at the university that's called the Social Work Community Outreach Service, or SWACOS, and they're very influential and integral members of our initiative steering committee, and they're doing really fabulous work with a variety of different agencies and placements here within Baltimore City and throughout Maryland and into D.C., where there are placements and opportunities for students to do financial social work along with other interventions with clients and with communities. and also the opportunity to work with our alumni who are working with different asset building organizations in our area. Next slide. Our integration into research. We've got a number of different research projects that are underway and other ones that we are launching right now. One that is several years into it is called our Financial Stability Pathways Project. And this is a project that we are doing in collaboration with one of our nonprofit partners called Maryland Cash. Cash stands for Creating Assets, Savings, and Hope. And this is an organization based here in Baltimore, serving Maryland, and we're working with them and with other agencies and nonprofits here in Baltimore City as they work with clients and folks who are in need, offering an intervention on financial education, financial coaching, using an online tool which is hosted by the Aspen Institute, which is called Aspen Asset Platform, and so using this intervention and then researching not only the effectiveness, how clients are changing through the intervention, but also examining their own capability, knowledge, goals, and also looking at the providers themselves and having them fill out surveys and talking with them as well, and seeing how they are handling, doing financial social work, financial counseling with clients, and then how capable they feel in and of themselves with respect to their own financial wellness. This is a bit of an adaptation on Physician Heal Thyself, but it's just so critical for us as providers and practitioners also to be able to look at ourselves, look at our strengths and weaknesses, areas where we would like to improve, financial goals that we would like to set, so that we can feel more capable as we look at ourselves and then as we look to work together with our clients. Next slide. These are just some of the other research projects that we have going on right now. We've got a new one that we're launching with Junior Achievement and Maryland Cash to ascertain the feasibility of whether or not to launch a matched college savings account program for middle school children here in Baltimore City, and we've just started work on that. The second one, we have a grant. John Cagle, who's a new assistant professor here at the school, has submitted a grant to get funding for a study on financial burden at the end of life for patients and families, and then hopefully to develop an intervention that includes not only psychosocial and financial, but also a technological component to work with folks at this stage of life. We have a new project that we're coordinating and collaborating with Consumer Credit Counseling Services of Maryland and Delaware, along with a colleague from the University of Maryland, Baltimore County, in the BSW program, looking at debt management plan conversion rates with folks who are seeking help for really for overwhelming debt problems. And then finally, we are leading a consortium of researchers and scholars from other social work schools across the nation who are doing this work, similar work, different research projects, really looking at financial capability, both within curriculum and also within practice settings, to really learn and to help students learn and to grow in this regard. Some of our colleagues at Eastern Washington University, Washington University at St. Louis, and University of Utah have launched, I think they're well into a project of surveying MSW students and their knowledge and capabilities on financial issues, and then looking at their own capabilities and financial wellness as well. and we're joining onto that, as are many other schools. So it's important, too, to survey our MSW students to see where they are at in terms of these issues. Next slide. And this slide will be exciting happenings that we are involved in and are very glad to be participating in with our partners. My colleague Jody Jacobson has been doing a yearly special interest group at the Society for Social Work and Research, or SWR. That annual conference she's been hosting along with Mikal Greenstein-Weiss on financial capability and asset building, and that is something that we will be continuing. We also partner with, here at the University of Maryland, Baltimore, the Center for Financial Education and Wellness, and they are able to provide a lot of really useful seminars and activities, credit cafes, different classes, and so forth for students here at the University of Maryland, Baltimore, to deal with such pressing issues as student loan debt, taxes, evaluating benefits packages for new jobs, looking at credit ratings and scores and those sorts of things. So again, it really speaks to the importance of our looking at ourselves in terms of how we're doing financially and ways that we can improve so that we can also work really effectively with our clients and communities. Next slide. So again, why financial social work? And these were just some of the things that I had jotted down. Again, it's just so critical to develop interventions that address both psychosocial and financial realities. Important to develop new measures and surveys, surveys in other languages, that sort of thing, and kind of moving beyond the clinical into more of a meso or a macro focus, looking at poverty, income inequalities in our nation, things that we can do from a policy and a legislative perspective in terms of making things better for vulnerable populations and communities and different issues that are affecting folks. And finally, establish partnerships among schools and agencies, practitioners, macro social workers, and others. And that's why it's so exciting to be a part of this webinar today. And to hear about the work that Peggy is doing in Wisconsin and the work of the Center for Financial Security. It is just such an exciting time for all of us to be present and involved with what's going on in this field, and to really see its integration with traditional social work practices and assessments, interventions, and so forth, but really bringing it all together and helping people, communities, as we are trying to make things better for folks. And then the last slide is our contact information, both for Dr. Jacobson and for myself, the Financial Social Work Initiative at the School of Social Work. Please join us. Please feel free to email us with any questions, comments. We just are so eager to be in touch with people, and it's so exciting to be a part of this webinar, and I thank you all so much for participating and for listening. And please do stay in touch. Know that we are here, Jody and I are here, the initiative is here, and we would just love the opportunity to dialogue with you further. Thank you very, very much again.
Thank you so much, Christine. One question that has come in is actually for Peggy. Peggy, could you just comment on how did families receive the newsletters? Was this postal, website? So if you could just comment on that would be helpful.
Sure. The newsletters were disseminated a few different ways depending on the county and the resources and also the size of the county. Some of our counties were 14. My county I served was 18,000 people. And then our largest county was 168,000. So we had some different challenges with circulation. In some of the counties, such as myself, I just directly mailed to our 40 or so households, so the postage really wasn't that much of a challenge. But in some of our larger counties, the newsletters were sent home with the kids once a month. So it was nice to see that once they got home that the parents did grab them from the kids and went through the backpack and found the information in there. And now, in the past few years, we've had a lot of the newsletters being circulated by the Head Start home visitation staff, just bringing it right to the home once a month. I also know in some of the other counties it's added in as a one page in the other newsletter that the Head Start staff might be using. So it can be done really relatively low cost with no postage, so just making the copies is the largest expense.
Great, thanks for that. Well, I would like to thank everyone for joining today's webinar. In particular, thank you to Peggy and Christine for sharing such wonderful information. Just a reminder that today's webinar will be archived and we'll have a link at cfs.wisc.edu within the next 7 to 10 business days. And the next webinar is May 14th. It's Advancing Evidence-Based Policy. And Karen Bogenschneider, who's a professor here at UW-Madison, she will be presenting. This was rescheduled from March. So look for an invite and sign-up instructions for that. And thank you again for joining us. Have a great day.